People they talk about corona plus you.
You put the worry. You don't know say corona really kill black people.
Make you no make anybody lie you. Corona no dey slag give anybody crap. True say it start for China, but right there, it catch everywhere. Where they fit kill anybody, especially people where they get some other sickness. For places like Yankee, corona they kill black people pass. Yeah, Charlie. Some people say they talk say China people with shara do am, or it be 5G self where they cause them. But shine your eye, it no be anybody do am. Where 5G too no go fit cause the sickness. The 5G self, it dey like the 4G way we all they take browse ready. It just be upgrade. People too they talk say if you get corona with chop plain, take garlic, onion, ginger and lime, the sickness go. But this one too be lie. This thing's good for the body, mom, but I don't know if it prevent or cure corona.
So what about Sobolo?
Me self, I dey like Sobolo, but him too no they do corona nothing.
Appeal to
Corona mainly they attack the lungs, so appeal no go fit do am nothing. The truth be say, people wey dem dey booze, corona dey feel worry them papa. People too they talk say if you cut onions put your room, corona no go come there. But corona no dey like mosquito, where go fit kill am plus coil.
Then how we go feel protect on our body?
Corona dey spread where more people self get, where they no know. So Charlie, if you no get anywhere important go, make you dey house. But if you really for comot, then you for wear mask, then stay at least 2 meters away from other people. If you dey wash your hands, then use hand sanitizer more times. But abeg, make you no drink am. If you dey call for sneeze too, do for your elbow inside. Take some bleach to clean surfaces where they touch. But this no be for your body. Finally, if you feel say you get corona, make you go chop for one corner so say no go spread am. If you get plenty rest, then drink more fluids. But if you dey make worse, then for call the emergency numbers. Charlie, this be all for today. But if I hear any other thing, I will come we could talk about them. For now, if we make sure say we go protect we, one our family, one our friends, then everybody from corona. We all for play one apart, so say we no go increase the pressure where it dey on a healthcare system and on a healthcare professionals them at all.
But we for take responsibility and keep fighting with positivity.
Welcome to the Health Info Africa show, your weekly source of critical health news, information, and education. Each week, we bring you in-depth discussions that enhance your ability to find, understand, and use health information. My name is Afosa, and I'm co-hosting the show with Edward. In the first segment, we'll assess the latest COVID-19 developments in Ghana and the related public health response. We have our regular guest, Kwame Sapamwasiedu, a pharmacist with over 22 years of practice in a wide number of areas, including public health and community practice. We also have Nana Kofi Kwache, a public health specialist and a doctoral candidate at New York University. In the second segment, we will talk about healthy eating, and we have with us Dr. Priscilla Marble, a medical doctor and a certified health education and health and wellness coach. We also have Eric Anku, a registered dietitian, with us. We'll be right back after a short break.
It is the senior most community pharmacist, Dr. Tuli.
Tompo Asembeng.
Oh, no lie. Then I say if your driver can't pick you, I make you people give me lift go. Shackers inside now. I'm at say it's on link copy. But
Tompo, 11 p.m.
Oh, if it comes a seed in the who give me. I guess some entanglement before that side.
You know they hear social distancing, eh?
To leap from D, same crowd, the whole. As I be young in the Amazon, are they cool? If you no go pick me to catch them in small left.
See, this be the problem. Who tell you say corona affects youngins? If you know they care about your life, if a guy say NSW over 50 years, away get hypertension, where puppy to be diabetic. Charlie them their cold will mess them up.
You are go wear face shield.
And that changes anything? That thing they protect only your eyes.
Plus face mask.
Charlie, the youth will take this thing for granted. It may not kill you, but if it give you long-term damage to vital organs like your lungs, if you go get for outside cargo house, they give your OGs where them die. Will you be able to fend for yourself?
Chama, so I can say because unless I start, they do Yahoo, I enter Benino, na phone cost me this the COVID itself make it left one at top.
If people know they follow simple directions like social distancing, hand washing, wearing face mask and things, the COVID no go anywhere. And the way they make careless there, it be like you no go left with anytime soon.
So to say my shadow make beans eh?
If you love yourself and the people around you, they house and take your shadow go back cry.
You are here, you more like dog me. So they kill my vibe cry.
But we for take responsibility and keep fighting with positivity.
All right, welcome back, viewers. As I said earlier, we have Kwame Sapamwasiedu, and then we have Nana Kofi Kwache with us. Welcome back, guys, and it's a pleasure to have you on again.
Thanks for having us.
Thank you.
Yeah, so we have a lot to discuss today. So I'll just want us to get right into the issues. And I'll start with Nana Kofi. So, Nana Kofi, regarding the COVID-19 situation in Ghana, what are the numbers telling us? This past week, what have we seen?
Well, what we've seen the last week has been generally a sort of stagnating of the test positivity rates. The general suggestion there would be that, we for the last week and a half, we've really been around that 15 to 20% range for positivity rates. February 2nd, or the data that's come in February 2nd, we did have a bit of a spike where it went up to 30.5% for contact tracing, for positivity rates in that group. But for the most part, the positivity rate has stabilized at that very high rate. We are seeing, obviously, that we are detecting many more cases. Apart from a brief drop, I think, on February 7th, all the rest of the data has consistently still been about 700 cases. And we are quite obviously seeing that some of those cases are the ones that we are finding out about in schools like AIS and other academic institutions and workplaces where there are, some small clusters or small outbreaks right now. But overall, the picture hasn't really changed. We're not seeing the kind of improvements we need to see in positivity rates in new cases that would want. The one good thing here is that we are still maintaining that relatively high rates of testing from January, where we are still testing in the region of 3,500 and 4,500 samples a day. And that is at least giving us a more accurate sense of where we are than what we were doing 2 months ago. So the overall picture hasn't changed much. We're still facing many of the same, trends that we've been seeing. And that would suggest that the desired impact from some of those measures around physical distancing, such as the reduction in capacity for funerals, weddings, and all those kind of things, may not be translating effectively, because we still know, especially with funerals, that compliance is not really where it needs to be. There are big ones happening in and outside our crowd still every weekend. And we know that as far as that's the case, it makes sense that we would not be seeing major differences or declines.
Yeah, thank you, Nana Kofi. Kwame, let me bring you in. So I just want you to add your thoughts to this particular thing we're discussing. And also, there's something interesting going on with our mortality. And I've seen some comments that you have put on social media about this. Can you speak on these issues?
Thank you. I think Nana Kofi has given the broad strokes about where we are, and that we are not getting worse, but we are not getting better. And that is broadly the case on the national level. But when you look at the micro data, you come to realize that that is the same picture. So if you look at, for example, though our numbers, average numbers per day active cases, are still over 700. Like Kofi said, there was a blip a few days ago where we went to 500, but it's mostly over 700. Our severe and critically ill is not changing as well, as much. It's normally above 130 people per day. But what is instructive is if you look at the period from the end of January to the beginning of February until now, our average daily mortality has been creeping up. So we were something about 5 mortalities being reported per day. We went to 7, and last week we were at 8, now we're at 9. But the data coming up in the last 3 days indicates that the data for the next 7 days would be that our mortality would be higher. And why do I say so? Today, for example, the report coming in for the 9 points of mortality of 13. The previous day was 11. The previous day was 10, which is much, much higher than the daily reports for the previous 4 days. So it means it's going to go up. And why do I say that this is concerning? It is concerning because in epidemiology, mortality is the last result of all the activities that go on. So first people get infected, then out of those who get infected, some get mildly ill, and then out of those who get mildly ill, some will get moderately and severely ill, then some will get critically ill, and unfortunately some will die. So when you see your mortalities going up, it means all the other dominoes are going up as well. And so when you do the statistical modeling, which says that only about 1 to 2% of your cases from moderately ill end up as mortalities, it gives you an idea of the stress on our health system. Because what it means is that today, 13 people have died. We've gone from 505 to 518, albeit it's a few days back data being reported. But if that is 1% of our illness population out of our active cases, then what you have to look at is 13. If 10% it will be 130. If it was 100, it will be 130. But we're looking at in our thousands, and then we're looking at 7,000. So that is the volume. So clearly, we've got a lot of cases that are being dealt with. And if you look at the number of health assets we have to deal with those sets of cases, then you realize that our mortalities might begin to get out of place because quality of care is going to drop. And that is why I've taken my time in doing the numbers first from front to back, and now I'm doing it back to front, looking at the mortalities as they are being reported now and what it should be telling us. So and for me, that should be concerning.
Yeah. And Nana Kofi mentioned that our measures were not really giving us any significant impact. If under a minute, you can just comment on what he said. He made reference to the funeral still taking place and a few other ceremonies still going on. So if under a minute, just comment on what is going on.
Well, probably I'll use 10 seconds. The truth of the matter is, if they were impacting, the domino effect I just said would not be happening. It would be going in the reverse. Less critical, less severe, less mortalities, less infections. So the fact that it's going the other way confirms what Nana Kofi has been saying.
All right. Nana Kofi, let me bring you in for this one. So Parliament, as we all are aware, had to close for 3 weeks. What does this say about our COVID-19 situation in Ghana? And our government is pushing for self-responsibility, personal responsibility in this particular pandemic. This is the case where our parliamentarians were not even able to practice that self-responsibility, and hence everything had to be shut down. But we have schools open. I mean, what does this say about our situation?
Well, I think it puts into context why the suggestion that what's supposed to happen here is solely an issue of personal responsibility. It highlights how that suggestion is not really grounded in the broad contextual realities of public health communication. People take their cues from the people who are giving guidance in broader public life. We are in a situation here where most people are not public health experts, and most public health experts are not even pandemic experts. And so a lot of people are trying to apply their discretion as well as they can to interpret the information they're getting, to interpret their understanding of the risk around them, to form some kind of assessment of what they need to do, how seriously they need to take precautions, and how they ought to act given what the risks are. One of the cues people take is what leadership does. It's not for nothing that, as we said many times here, the issue with the election season was not just merely the question of transmission. It was partly the question of normalizing bad behavior during a pandemic because the people at the top didn't seem to believe there were consequences for it. That's something that carried on in the general public. Now, you have in the case of Parliament a situation where, to start with, you have the Speaker requesting all parliamentarians to get tested, 60 of them basically refusing to until they were threatened with sanction if they didn't. Then of the 275, 16 of them getting infected, and many of those refusing to quarantine or isolate in this case, despite knowing their status. And then for them to keep coming to work, for Parliament to keep sort of tolerating that behavior where, despite the knowledge that there were actively infected people still come to the chamber, nothing was closed, nothing was done. I mean, you can think there about what that does, what that says about workplace management or what workplaces take from that. But then you go on to have the consequences where out of the first 500 staffers tested, 115 were positive for COVID-19. That's a 30%, like a range of 30% positivity rate.
Right.
You have to wonder, you have to wonder what kind of cues that sends to people about how real the risk is, what kind of signals it sends about how you should behave if you're infected, or how you should, or what measures you should take if you've been exposed. And it speaks a lot to the challenge we're having with controlling work infections in the workplace, where because there's no strict guidelines or specific guidelines given support for situational decision making, people are applying their discretion in the workplace. And we're seeing how even at Ghana's most famous workplace, that is still applied there, that's applicable there, and how it's having consequences for the failure to limit infections and failure to control infections.
Yeah.
I hope that as part of the measures that Parliament has taken at the end of these 3 weeks, they will actively push to make sure that there are existing workplace guidelines that other offices, other workplaces can follow to avoid the same situation, and that they start to take seriously their responsibility about being ambassadors for good behavior, especially if one of the main themes or one of the main focuses of our version of COVID-19 management here in Ghana is to say that personal responsibility counts. Then you must set good examples and give a good framework for behavior that people can actually follow, and that actually allows people to understand that these things must be done because the risk is real, and if we don't take those things seriously, we'll fail at infection control, and there'll be consequences, because obviously those 115 staffers don't live together in a one-bedroom self-contained.
Right.
They have families, they live in communities, and all the time that they were coming to work, getting infected, going home, knowing that there was a risk from infected parliamentarians, all of that is stuff that is going to definitely, there'll be some people in those transmission chains who will require clinical care or critical care. Some of them might not be able to get it. And all that comes from the irresponsibility of some 15 or 16 people, not all of them, but some portion of them, and what that means for their staffers and the families and the communities.
Right.
So I hope we take this one seriously and really demand some accountability and honestly a public apologies for the behavior that's resulted in this kind of an outbreak there.
Whether we get that is something that, we'll all wait to see. But there's another issue that I want to bring Kwame in to talk about. Airport testing at our airports. There's so much that has gone on. I just want us to talk about this. Just briefly, if you have any comments with what's going on. For instance, there are issues about the antigen test, which a lot of people complained about. We had a lot of, complaints with their, ability to detect cases, how things would go through the cracks. And now there's so many other, I don't even know how to go on with this particular one. If Kwame, you have any comments on the airport issues, I'd want to hear them.
It's interesting. If you look at it from a testing standpoint, as a quality control, quality assurance professional, the first thing you do with any test is to say, what's the gold standard? Because for every testing regime, you would have a gold standard. In this particular instance, the gold standard is PCR. Yes, there is ELISA, but how many people use it? So the gold standard is PCR. So any test that is coming in should be as close to PCR as possible. The first anomaly was that we were giving the impression that the antigen test that was coming in at the airport was virtually identical to PCR, even though the manufacturers were reporting a sensitivity of 87%. But for some strange reason, all the communication kept saying 99%. That's fine. Because then the explanation they gave was it was because for the samples they tested with PCR, the antigen test was able to identify 99 out of 100 of them. So they said 99%. But that was strictly accurate from a quality control and quality assurance standpoint, because what the manufacturer had said was that out of every 100, 13 would be missed. Then the next thing was that for a test that was subsidiary to the gold standard, we were charging more than what airports that were doing the gold standard were charging, ostensibly because the argument was that if we had done PCR in the airports, people would have to go and stay in hotels for at least a couple of days for the PCR results to come. And I remember on another program with Nana Kofi Kwache earlier, when all these debates were going on, me pushing back and saying the PCR coming 48 hours later is nothing to do with the frequency and speed of turning out a PCR. It's got to do with the more of the pressure we put on our systems. And if people would be currently, there are private providers who can test and give you your results in 4 hours, who can test and give you your results in 12 hours, depending on how much you want to pay. That is a tacit acceptance that PCR turnover doesn't need to be that long. But that was the reason that, therefore, if you're going to stay in a hotel and you're going to pay, let's say, $100 a night or $150 a night, and at least you are going to stay 2 nights and pay for a PCR test, then charging you $150 for a 30-minute test was affordable. I found that as outrageous an explanation to give from a scientific or affordability standpoint. Now, moving forward, suddenly there was an ECOWAS meeting, which was chaired by our president, Nana Danko Akufo-Addo, and it was agreed that for ECOWAS nationals, and listen to this clearly, PCR testing should not cost more than $50. And the communique is available. It didn't say testing, PCR testing. They were specific about the testing that should occur at ports of entry should not be more than $50. So what did we do? We decreased our second rate, which is not the gold standard PCR, to $50. Now here's the question. If the company is making, because the argument is that it's been reduced for Ghanaians and ECOWAS nationals to $50. All other nationals pay $150. Mm-hmm. Through our airports, by and large, over 85% of all passengers are Ghanaian or West African origin. So if we can charge $50 for testing for the majority of people who use our ports, and the company would still make a profit, then the question I would ask is, why did we start from $150? Especially when you go into the biomedical markets and you realize that the lateral flow test, which is the antigen test, ranges from $3 to $12, depending on where you're buying it on wholesale. So you can talk about them having to put infrastructure, you can talk about them having to pay staff. But even if I go with the upper limit of $12, and I assume that you pay staff, equipment, and other things, even $30, which is exorbitant because there's no one who will put any infrastructure in place that the staff component will be more than the testing component. We all know that. We all work in senior management, we're all researchers and all that. And we know that that doesn't happen. No organization would pay their staff more than they pay for the HPLC, for example, or their UV mass spectrophotometer. It doesn't happen. But we're charging $150. So now we're charging $50. That's fine. You can accept that in that case, we have decreased the price, but we are still charging the foreign nationals $150. Let's park that. Then we say, okay, our parliament is the highest authority in the land. We're in a country where there's a law for freedom of information, but it cannot, and it doesn't work. The average person cannot get information even if they invoke the freedom of information law. Our MPs are vetting ministers who have to then become substantive ministers, because at the moment they're designates. And there's a health minister appears, is asked, did you see the contract? Says no. And then you ask why. So the decision was made by the Presidential Task Force on COVID. He's asked, are you a member of the task force? He says yes. Say, but you said the decision was made by that task force. You are a member. So yeah, I still didn't see it. Then park that, because this is a public health pandemic, and public health comes directly under the forte of the health minister. So park that, because I cannot accept that the person is being honest with me. Then the foreign affairs minister, who's in charge of the airport, also comes and is asked, have you seen the contract? No, I haven't seen it. But we are told the airport authority, which is a statutory body under the Ministry of Foreign Affairs, was the one who is the procurement entity, because our procurement law says you cannot procure anything without a procurement entity. So the task force is not a procurement entity. The what the airport authority is procured it. The minister directly in charge have not seen the contract. Okay, that's fine. Let's assume they're all telling us the truth. Then the deputy health minister, who was the linchpin of that task force and in charge of this, goes on national radio on Joy and then says, I've not seen it neither. And you're like, what the hell is going on here? So who's seen this contract? Okay, let's assume they've all not seen it. But contracts are legal documents which a country goes into on behalf of its citizens, and therefore there needs to be a legal input. So who is the legal officer for the government of Ghana? The Attorney General. The Attorney General designates who was the Deputy Attorney General, because there were two Deputy Attorney Generals, but this was the one under whose forte all the market comes. And is asked, Godfrey Dami, who's my junior at Saddle College? Have you seen it? No, I didn't see the contract. And you are like, what the hell is going on here? So who gave the legal advice? And you then ask yourself, is this a comedy of errors or what? And so with all that going on, it comes across as though people want to treat us as idiots and are just not prepared to answer the question on, have you seen the contract? Because if you then answer, have you seen the contract, then the next question would be, who is the contract with? And then you have to talk about Frontline. Who owns Frontline? And then you can start picking the dot. But if I've not seen it, you cannot ask the second question. Right. You need to continually dwell on, have I seen? Because if I've not seen the contract, you cannot ask me, who's the contract with? And then I don't have to answer because I've not seen the contract. And then if I don't have to answer who is the contract with, then I don't have to answer who owns it. And the veil of ownership doesn't need to be lifted. And I'm like, we live in a country of laws. How can we be operating such a kamikaze system? And that is my view about the airport situation.
Yeah, let me bring Nana Kofi in for a few comments. Nana Kofi, I think Kwame has said a lot. If you can just add a few comments before we move on to the next topic, which is vaccines, also very important. So Nana Kofi.
Yeah, I think Kwame has laid out what appears to be a series of rather confusing and unfortunate facts around, the nature of contracting for the testing. So I'm not. I'll leave that contracting part alone because it's been well discussed. My concern about the testing at the airport is in the stuff that went into justifying it and the things it implied about what we could and could not believe and could not do about and with our COVID-19 strategy. We had a situation here where, like Kwame rightly said, the deputy health minister came out and was a very vehement defender of the COVID-19 antigen test at Kotoka Airport. There were times where, in the way he communicated it, he would repeatedly say that, this test had a 99% sensitivity, and always portrayed the antigen testing that's going on at Kotoka as though it was a particularly unique solution that came at an opportune moment that couldn't be passed up, and that because of its high sensitivity, the pricing made sense because it would allow you to eliminate quarantine, which was implying that this was something that was so field-proof that quarantine, a public health best practice for 6 centuries, would not be something that would be necessary here because the testing was good enough to pick up cases. Now, the claim about whether or not it was 99% sensitive, that requires us to also sit here and believe that if that there was enough testing, or the testing done was representative in a way that the for-profit manufacturer of this device was underselling the sensitivity of their device, when they had a device that somehow was as sensitive as, PCR testing, were voluntarily choosing to undersell it as just another antigen test, which is what it is. It is just another antigen test. This is the AFIA's COVID-19 AG test that is performed on the AFIA 6 system. These are tests that can be bought and purchased basically for under $20 a kit. The devices that you actually use to run the tests on the AFIA 6 system goes for about 4,200 a unit. So even if you bought 40 units, as I think is the number we're using at Kotoka, a single day of arrivals at Kotoka Airport on the first day, 111, I think it was about 1,100 arrivals, would have been enough to defray the total cost of all the equipment that went in there. When we say that we have to put in infrastructure, what are we talking about here? With the exception of those devices, we're talking about PPE for the staff, and then we are talking about dividers and line management crowd line management tools or queue management tools over there. Those things on the second day would also all have been paid for very, very much comfortably. So the rest of it becomes a question of then what was the pricing really based on? Because obviously it doesn't appear to have gone through any critical review. It doesn't seem like anybody who should know about it knows about it. And it does seem basically from, if you listen to what the former Deputy Health Minister has been saying on radio last week, that, this is a price that was paid because, quote unquote, we live in a free market and we're not in a controlled economy, which is basically an excuse for saying in a public health crisis, some profiteering will happen because we live in a free market, because people who understand the way these things are costed know that $150 is an absurd price for an antigen test by any measure. It's more expensive than 2/3 of PCR tests that are conducted in America, and those tests include health insurance profits.
Right.
And so we're sitting here, justifying things that are not justifiable. But in the justification of it, making these weak arguments the basis for a trade-off between, this kind of testing system and quarantine. And now we know that, I heard, the former Deputy Health Minister saying today that we should look at the 1,100 and something cases that were detected at Kotoka, and know that the system caught those. But we can also do math and know that the 12.5% of cases they would miss amounts to about 166 passengers who went through directly into the public. So when in the other breath you're saying, and we should be mindful that it caught all these people because only 2 cases started the pandemic, what should we say about the 166 that came through with no quarantine? And that obviously have had a role to play in the current surge, because that is how the B117 strain got here. So it's something that is very aggravating for me on a personal level, because it was bad science, backed up by bad faith, presentation of what this test could and could not do. And that also undermined our public health effort by making it seem as though quarantine would not be a necessary thing here in this situation. And I hope that we will see more demands for accountability and ultimately get some real answers about what the contract says, and some accountability from the people who said, in June, July, August and September, that, they had seen that due process had been followed and that everything was kosher, like the former deputy health minister said. So I hope this will not just die out like regular issues in Ghana, because this is costing lives right now in this country.
Yeah, Nana Kofi, thank you. So we don't have much time. We have about 15 minutes more. There are a lot of things for us to discuss. I'd want us to cover everything. So moving on to the next one. I know with the airport testing, if we decide to spend time on it, we're not going to leave. There's so much in there. Now let's go on to talk about vaccines. And if you can, in 2 minutes, just tell us what we are doing regarding our receipt and distribution of vaccines. This question was posed last week. You said some amount of work had gone into it, or you heard some amount of work had gone into it. Can you give us updates, if you can be brief about this?
So currently, the target that has been set by the president is 17.6 million doses by the end of June 2021. We know so far that we can expect about 2.4 million of those doses to be Oxford AstraZeneca vaccines that we are getting through the COVAX facility. The question then is, what about the remaining 15.2 million? We are not too clear about exactly where those are going to come from. We do know that we will have access to vaccines through the African Vaccine Acquisition Task Force, which has distributed about, I think they said on February 4th that 16 countries combined had ordered 114 million doses. We know that between Kenya, Nigeria, and Zambia, that's about 47 million. So the remaining 17 million for those 13 countries is what we are trying to figure out. We're not sure if Ghana is one of those, or if we've applied, because we're not getting the information from the AU right now, and the local authorities here have also not been clear on that. But we know that we're going to be leaning very heavily on those AU supplies to get to that target if we're going to get there. We know also that we are very much going to now be restricted to Oxford AstraZeneca vaccine, and then other ones that can be stored at that temperature or warmer, because it appears that we are actually making a specific commitment to stick within the constraints of our existing cold chain infrastructure, which will rule out the Pfizer and Moderna options to us entirely, because if we are not going to invest in putting that cold chain infrastructure in place, then we won't be able to take delivery of that. And what that will mean long term is that basically these mRNA vaccines that are easily adaptable to new variants will not really be an option for us throughout the pandemic, which will mean that as new variants emerge, we will always be slower in responding to them in terms of vaccinations and acquiring herd immunity against them, because the vaccines we can store will take maybe 6 or 7 months to catch up with the variants.
Okay, Kwame, Nana Kofi talked about the new variants. He mentioned the B117, which we know is the one driving the pandemic in Ghana. Now, there's been some communication about the vaccines in South Africa, the Oxford AstraZeneca vaccine, to be precise. There's been some, information, whether it's been stopped, whether it's been paused, whether it's been halted. Can you just clarify what exactly is going on with this particular issue?
It's rather murky when it comes to the South African variant and the Oxford AstraZeneca vaccine, because the truth of the matter is there was a small study carried out in South Africa with about 2,000 patients, which found that when it comes to mild to moderate disease, the vaccine was effective in just about 10% of cases in preventing that happening. But that was a very small study, and it had no variance as to what happened in severe infection. So the South Africans held a press conference, and I was on that press conference, at which they said that they were going to pause, and that's the confusion that came. They were going to pause their massive rollout and rather trial it in 100,000 health workers to get an understanding of what was going on. You need to bear in mind that at this point in the pandemic, the major thing is to prevent severe disease, hospitalization, and death. And so they were like, if we can establish that in our health workers, because if your health workers are off, then you're losing the pandemic fight, because you need them to be at the forefront. They are the key workers to be at the forefront. However, for some strange reason, after that press conference last Sunday, it came across as though South Africa, one, had stopped the AstraZeneca. And it got further complicated, because then South Africa, not naively, but unfortunately, went on to say they wanted to pawn off some of the vaccines they had gotten from Serum Institute, which were AstraZeneca vaccines. So it gave the impression that it wasn't going to work for the South African variant, and they wanted to sell it off to others. The truth of the matter was that wasn't what was in the communication. What was in the communication was that they had received vaccines that were manufactured in November. And for people like Kwame, yourself, and me who work in quality control and quality assurance, we know that for biological products, the shelf life is 6 months. So those vaccines were going to expire in April. And they had ordered the quantity for the mass vaccination drive. Now they wanted more data based on their health records, which meant that by the time they get to the mass vaccination, probably some of those vaccines would be expired. Therefore, the decision was that let's give it back to COVAX and the African Initiative and all that, so that countries in these organizations who are starting their mass vaccination but do not have the South African variant can use them, because the WHO has said no vial of vaccine should go waste. So South Africa was trying to play ball to ensure that that dictum from the WHO happened. Unfortunately, the press read it differently, and different publications were put out, which led to the WHO coming in last Wednesday, holding another press conference. So the SAGE, which is the Scientific Advisory Group on Emergencies for the WHO, held a press conference. I was on that one as well. And I think I sent you even a link to go and watch the press conference so that you could also hear verbatim what was said. On that press conference was the Chief Scientific Officer of the South African government. And he was clear in reiterating what had been said 3 days earlier on the Sunday, and exactly what I'm saying, that they had paused and hadn't suspended. But the WHO then said, based on the data from the larger population globally, the AstraZeneca Oxford vaccine was the most viable, especially for countries like Nana Kofi has just said, who didn't have the extreme cold chain facilities and had to rely on their ambient cold chain facilities. So this brings us to the point where anti-vaxxers, vaccine hesitancy players have then picked on it, and it's going all over the place on social media. The simple thing I would want to say is that for those of us who realize the merits of vaccination, realize the strength of the chart that science has had to go through to get vaccines in less than a year for COVID need to be putting some of these information out, like you showed the slides from the South African presentation, and challenge those who are putting this pseudoscience to actually speak to what actually happened. Unless we do that, we would lose the fight and people would be very reluctant to take this vaccination. I'll end by saying this in 1 second. That even in the UK, currently 9 out of 10 people are taking the vaccines. But when you come into blacks, it's less than 30% over the age of 80. If that continues, we would disproportionately die. And for me, that would be a travesty for public health.
Yeah, again, heavy words by Kwame. We need to put in an effort to educate people on vaccines and let them know of the benefits. All right, thank you, Nana Kofi. Let me bring you in to take the next question or the next part of this discussion. So this is on the new variants that have come into the country, right? And when the genomic sequencing data that was conducted in January was revealed, we became aware that it was the B1117, which is the predominant strain in the UK, that was driving the infection, right? So we know there was a traveler that came in from Tanzania who was known to have the South Africa variant. Now, this wasn't picked up in January. What are the updates on that? Do we have that in the system, or do we have to wait for another set of genomic sequencing studies to identify whether we have that?
I think we might have to wait a bit more time for another round of the genomic sequencing, because I believe the UK variant that was identified for the first time in early December. And if you look at the time it took, for example, in the UK for it to go from 3% of sample sequence to 81%, it was about a month. And if you look at what we are reporting on 90%, that took about 6 weeks in the UK. And that seems to be about the time frame here as well. The South Africa variant, I think, was identified later than that. I want to get the exact dates correct. So it's unclear how representative it was in the sequencing, but we do know that at least at the airports from the genomic sequencing of arriving travelers, the South Africa variant was identified in quite a few. In fact, even with the UK variant as well, it was identified in mostly travelers coming from other African countries, not coming from the UK or Europe. So I think that suggests that we're just about to start seeing maybe more surveillance for that samples collected in that late December, January window, which will inform the sequencing we're going to be getting out maybe at the end of this month or early March. So I think it's important to put that time lag or time frame in context. But so far, we do know that was checked at the airport. It doesn't seem to be being picked up in the community testing from the genomic surveillance that was done. But let's see, another round that's done with more, with more samples tested. I hope we can scale up the end for that genomic surveillance to maybe about 1,000, 1,200 samples every cycle, and more nationwide, so we can get a sense of that. But that's the picture for genomic sequencing right now and where the variant stands.
Okay, all right. Thank you, Nana Kofi. So there's another question. Current existing vaccines are still being distributed, or we are supposed to be still having other vaccination programs going on in the country. Do you have any idea how these are faring? I mean, vis-a-vis trying to get ready for COVID-19 vaccination in the country?
Well, it's not too clear right now how the other vaccination programs have gone. We know for a fact that the Ghana Health Service did put in place and did activate all its usual structures for vaccinations for yellow fever, especially, and the other childhood killers that it does exceedingly well every year. We know that in 2019, I think the average coverage for the expanded program of immunizations was about 92% on the low end for the different vaccines that were involved in that. And we know that infrastructure, again, like I said, was reactivated in 2020. It's just not clear how successful it was at identifying all the people and also getting all the people to come and take the vaccine, especially because some amount of the vaccination work that goes on through the Ghana Health Service is from, care-seeking opportunities. So people coming into CHIPS compounds, district hospitals, teaching hospitals, and while they're seeking care at those places or clinics within those places, being invited to get vaccinated through there. We know that a lot of facilities also have to do outpatient department closures to make room for COVID-19 treatment. So that could also have affected the reach of those kinds of, institutional vaccination programs. We're just not clear on what the data says right now, but the Ghana Health Service did go out and attempt, as it does every year, to meet its obligations in that respect.
Okay, all right, thank you. We are actually 5 minutes into the second segment, but there are two questions that I want us to deal with before we leave. And let me bring in Kwame to take this one. So Kwame, two issues: long COVID and reinfection. You've talked about this at length. Nana Kofi has also spent a lot of time talking about this. There's been a recent case which is actually being talked about a lot. There was a recent publication on it in France where somebody has gotten critically ill from contracting another variant from, even though he had a previous infection 4 months ago. Like I said, you've talked about this at length. Just say a few words on the reinfection for COVID-19.
Thing is, we all know reinfection are real because while COVID exposure gives you immunity for 3 to 8 months, the mean is about 5 months. So 4 months is perfectly fine that they got reinfected. Unfortunately, the data is also suggesting that the second infection leads to a hypersensitivity reaction for some people and an autoimmune response, which then means that your likelihood of being very unwell with your second infection is high. But the truth of the matter is this should be expected because that is the whole essence of the booster jab when it comes to immunization. They want your immune system to react more vigorously so it can use antibodies to protect you in the future. So basically, your immune system is actually doing what is expected of them when you're exposed in the wild on 2 occasions. Just that because the exposure is wild, you are fighting a disease and not fighting a primer. Because a vaccine is a primer, it primes the immune system, it trains the immune system. Whereas a wild exposure is an infection. It is there to make you unwell. And that is the reality that I believe Ghanaians need to draw the attention to. A lot of people who were infected. So when I look at our data, we had over 60,000 cumulative cases. I always tell people who want to listen that about 45,000 of those are due infections now because they were infected from March till about September, October. So they are eligible if unfortunately or fortunately they didn't die by the first infection, their immunity has waned and they are due to potentially be reinfected. And therefore, until we get the vaccines, the protocols are your vaccine, whether you've had it before or not. If you don't comply, you are putting yourself at more risk than you were when you were first infected.
Yes, so you've heard it. The protocols are what are going to protect you until we get our vaccines. So at this point, I want us to bring this first segment to an end. Let me invite Nana Kofi for final comments. After that, we'll move on to Kwame briefly, and then we'll head out.
For this week, I think the big takeaway is to keep an eye out for what we're going to hear, or to see if we do hear anything about vaccine supplies coming from the AU. That is really going to determine whether or not the president's 17.6 million dose target is going to be hit. And I'm hoping that as the AU begins to deliver or roll out deliveries towards the end of this month, we will see some more clarity about that and get a sense of what we can expect.
All right. Thank you very much, Nana Kofi, and we hope to have you here with us again next week. Kwame,
my pleasure.
Let me bring you on to give your final word, and then we'll head out.
It's clear that on the basis of our numbers, on the basis of our mortality spikes, the interventions that were introduced by the president 2 weeks ago have not really brought community spread under control. I'm hoping we hear from the president tomorrow, and I'm hoping more action is taken because our numbers as it stands don't look great. To the average Ghanaian listening to us, I would want to say we are in self-preservation mode now. It's now not anything to do with what the president says or what I say or what Nana Kofi says or what you, Kwame, you say. It's about realizing that the numbers that I quote, Nana Kofi quotes, or anyone who speaks on common quotes are human beings. The dead are people like you and me who were speaking last week, but unfortunately are lifeless today. You can prevent that from happening to you by complying with the protocols. And that's how I'd want to leave it.
All right. Thank you very much, Kwame. We really appreciate you being with us again, and we hope to have you again next week. So thank you very much, Kwame.
Thank you.
All right, viewers, this is the end of the first segment. And like I said, we have another critical piece of information to share with you, which has to do with healthy eating. So is it a sustainable lifestyle or is it just a fad? And when we return, we have two specialists to talk to us. We have Dr. Priscilla Marble, and she actually has a passion, which is to empower individuals with the necessary tools and support that is needed to design and enjoy a healthy life and future. And then we have Eric Anku. Now, Eric is a firm believer in the immense role of nutrition in managing and preventing non-communicable diseases, which we all know is the largest contributor to mortality globally. So stay with us. When we return, we have these two specialists to talk to us. Hi, Edward.
Hey,
Welcome
Kwame.
back. Yeah,
that
so
was an intense discussion about COVID, man.
yeah, very intense discussion, and I'm hoping we're going to have a wonderful session as well. I'm sure we are, and I want you to take over this part, which has to do with the
Sure.
healthy.
All right. Thank you very much. All right. So thank you everyone for sticking around and still listening to us. Our second section is pretty much gonna be on something that everybody, I mean, especially in January of every year after you go on your 31st night and you have all your yearly resolutions, you tell everyone, hey, I'm gonna eat healthy. I'm gonna exercise and I'm doing all those kind of things. And now the question becomes, is it a sustainable thing that you can do? As we are getting to the middle of February, a lot of people have thrown these resolutions to the side, including myself. But today we're going to dive into whether this is a sustainable lifestyle that you can live, or it's just something that we all talk about and just not really worry about it. So to join me today, as Kwame has already mentioned, I'm going to have Priscilla and Eric join me to do the discussion. Hey, Priscilla, how are you?
I'm good. How are you?
I'm doing awesome. How about you, Eric? Eric, I think your mic might be muted. All right. So whilst we try to get Eric on the line, I would like for you to introduce yourself to us, Priscilla. Tell us a little bit about what you do, even though we've given a little snippet of it.
Yeah. Thank you for this this opportunity. So I am currently in the US. My original career was medicine, and then after I moved to the US, I moved into the area of public health, and I'm specialized in like health, wellness, nutrition, coaching, and just things that can empower people to take better care of themselves. So.
All right. Thank you very much for that. Eric, can you hear us now?
Yeah, I can hear you. I hope you can hear me.
Awesome. So tell our beautiful listeners about yourself and what you do.
Okay, so I am a registered dietitian here in Ghana, and I currently practice at the Cape Coast Teaching Hospital, where I mainly do a lot of clinical nutrition stuff. I also have a background in public health, so I tend to also have a passion for preventive health. particularly about non-communicable diseases and how they also impact our health in general. So then how to use nutrition to prevent some of these non-communicable diseases is one of the things I'm passionate about.
Great. Thank you very much for that. So we'll go straight into our discussion today about, healthy living and as a lifestyle or if it's just a fad. So the first thing we wanted to talk about is what actually is healthy eating, right? There was an interesting story about a guy who went to the doctor and the doctor said, hey, you have to reduce how much fufu you eat, right? And then the doctor said, well, instead of getting 2 balls of fufu, you got to get one. So when he went home, he just merged the two together, and I think he thought it was just okay with him, right? So the question is, how do you define what healthy living is? And we know that in Ghana, somebody who has a pot belly and looks fat, is seen as somebody who's rich. So with a lot of our listenership coming from Ghana and all of that, I want you to touch on what healthy eating is and why we should actually encourage it.
All right, sure. So I'll take that. So healthy eating simply means that you are eating, number one, a variety of foods that helps to provide you with the nutrients you need, first of all. And its goal is to help you to maintain your health, to give you energy, and also just make you to feel good. So then the key takeaway here is that healthy eating involves eating, number one, a variety of food. So then your food has to be varied to give you all the nutrients you need. And the reason why we say the nutrients you need is because then there's no one right way to eat healthy. And it might vary for every individual as well. So then it's supposed to provide the nutrients you need. And then the goal of healthy eating is then to maintain your health, number one. And two, you should also be able to get enough energy from eating healthy. So then we've seen a lot of studies that have looked at how healthy eating can promote resilience. That is your capacity to manage stress. So then there's some form of evidence that eating healthy can also do all of that. There are some principles also that surround healthy eating. I'll just make them summarize in what we call the ABCMV. So it's very easy to keep in mind. So the number one for A is adequacy. So healthy eating should provide you the adequate amount of nutrients you need. So adequacy is very important, whether carbohydrates, protein, fat, which are the macronutrients, which is you need them in relatively large amounts. And also your vitamins, your minerals, and water. They should be adequate enough to maintain your health. Then two, we also talk about balance. So that's a B. So your meals need to be balanced to provide you all that right amount of nutrient that we all need. So then it's not about a one size fits all approach, but then there should be some balance in what you do. Then the C there stands for calorie control, where whatever you still eat should be able to give you enough calories to not make you go over your weight or also go below your weight. So then it just helps you to achieve and maintain a healthy weight, which is very, very important. Then the M there, so it's A, B, C, M, D. M there's moderation. So then there are some who would say that, oh, because they say fruits are good, when mango is in season, I'll sit behind a pan of mango, eat all of that. Yes, mangoes are good, fruits are good, but moderation is key. So then, in as much as we are promoting all these healthy things, we should also keep in mind moderation. Then the last bit of it is variety. If you don't have varied meals, you're not likely to meet the nutrients you need. So then having a varied meal gives you that opportunity to be able to meet all the nutrients you need. That helps you to maintain your health, helps you to feel good, and then also gives you the right energy you need to be able to empower your day.
Awesome, awesome. So I mean, just to piggyback on what you just said about moderation and adequacy and all of that. So I'm just gonna assume I'm somebody who doesn't know anything about that. How do you define what adequate is, right? So to someone, adequate is like a large sum of food to until they feel like I'm full. How do you define that in a layman term?
Okay. So then we have what we call some reference intakes. So there are some standards we have that helps to define how much of nutrients you need per your age, per your sex, and also per your life circumstances. So then we try to look at all those factors. So how old are you, number one? So young children will tend to have different requirements compared to, let's say, an older person. Let's say for calcium, older people may require more for calcium, than for a younger child or maybe a regular adult. So then we don't have it fixed per se, but then we try to look at what we call the reference intakes. And then based on your age, whether you're a male or female, whether you are pregnant or not pregnant, whether you are ill or you're not ill, we look at some of all those things and then we try and look at what is required of you. Then we can say, okay, this is what you should be taking for calcium. This is what you should be taking for carbohydrates. Then to come to that also, for the macronutrients, we have a term we call the acceptable macronutrient distribution ranges. So then we've been able to find from literature some amount of percentage ranges for those macronutrients that are very essential for health. So then maybe for carbohydrates, for example, we could say that for your energy needs, we'll make it about 45 to 65%. So then based on researches and studies, we've been able to see that that range is very helpful and it doesn't go beyond what you need. And like I said, it's not set in stone. So then we usually have to look at how old you are, your sex, and then all other clinical conditions to come up with what is adequate for an individual.
Awesome. So that takes us to the next question about, now we do know what healthy eating is, right? So then we want to focus on what is not healthy eating. When do I say that, hey, you know what, you're not eating healthy? I think I'll let Priscilla come in with that.
Okay, thank you. Yeah, so I'll just kind of support what Eric said, that healthy eating is about, including important nutrients. There are important nutrients that we all need to have, in our diets. At least by the end of the day, you should have, accumulated some amount of healthy nutrients. So that's about healthy eating. So what healthy eating is not, I think when it comes to healthy eating, people think that it's out of their reach. It's too complicated. It's too many demands. It's don't eat this, eat that, and sometimes the information and research keeps changing and all that. But what we want to establish here is that healthy eating is about choosing or making effort to choose more of the healthy items and making extra efforts to reduce more of the unhealthy items, right? So at the end of the day, you have maybe like 70% of your choices are healthy, and maybe 30% could be the unhealthy one. So let's not look at it as I have to take all of this out of my plate. They told me, well, I can't eat fufu ever again, or I can't eat this ever again. But let's see more of it. Let's see it as I'm going to try to increase more of the healthy ones and then reduce more of the unhealthy ones. So, yeah.
All right. Okay. Great answer. Great answer.
Yes, go ahead, Eric. Something. So then, just as Priscilla had said, it's not necessarily about depriving yourself of enjoyable meals. I know when some people hear healthy eating, and in their first of mind, it's like, Charlie, they're going to say that don't deprive yourself of all the foods you enjoy. But that is not really what healthy eating is about. So it's not going to necessarily deprive you of enjoyable meals, but it's just going to empower you to make the right choices. And then based on those right choices, you can also maintain your health and then just live healthy. That's it.
Well, before we go on to our next question, I just wanted to find out, why is it that the unhealthy food is so nice? Why it gotta be so nice, right? Yeah, go ahead.
I think sometimes the food industry, they have tricked us with some of the additives and like the things they add to the foods, like the fats, the sugars, and the salts. We've known of researchers shown that sometimes it has an impact on some part of our brain, the part of our brain that causes us to like the addictive part of our brain, right? So it's part of their strategy to get you to buy more of their products. So that we can control that part, but. And so the important thing that I hope everyone will get at the end of the day is that to be able to identify that this is healthy, right, and this is not. So I should make an effort to go more towards the healthy, right, and unhealthy. healthy foods doesn't mean it can be sweet, it can be nutritious, it can be delicious, right? You can get options that are healthier than the unhealthy ones, and still get that same, sweet taste, but in a healthier variety. So
Great. So this is a conversation that I don't think a lot of our Ghanaian folks have, right? So I remember I had a friend who, supposed to be eating healthy, and when you start eating those vegetables, he goes like, oh, vegetables there for ponchi or something, right? So they try to discourage people from eating healthy, or you can hear somebody say, oh well, senkuntum rema moja dianka I or kona wana moja fini remember. These are all kind of statements people make, and then it kind of discourages people. So I wanted you to highlight some of the benefits of going the other way of not eating all your stradinam and trying to stay within certain amount of food. What benefit does it give to you as an individual?
Okay, sure. So just as I said at the beginning when I was introducing myself, that I'm very passionate about non-communicable diseases because they are like the #1 contributor to mortality or deaths around the world. Now, when you come to our country, Ghana, we also have our non-communicable diseases growing. Back in the days, it used to be infections, so malaria and all those things. But in recent times, we are seeing a surge in all these non-communicable diseases, hypertension to start with. That's high blood pressure, that's high blood sugars. And then recently, there was a study called the Global Burden of Disease Study, which is something that is done to look at the impact of diseases in countries and around the world. Mm-hmm. And recently, stroke has been highlighted as one of the major contributor to death in Ghana. And it's all due to lifestyle factors. So then usually when you follow a healthy diet or a healthy lifestyle, it helps to prevent these non-communicable diseases. We don't always have to wait for a problem to act. But when we proact or when we are proactive, we tend to now kind of look forward to what can come forward. So then we are prepared for it. And eating healthy is one way to prepare to prevent those diseases or ward them off. We can't always say that the risk goes away, but then it lowers your risk of those diseases. And even if those diseases come, okay, like for example, you already have high blood sugars or diabetes. If you eat healthy, it helps to prevent them from getting to very bad stages. So there are people who would have high blood sugars, do nothing about it, and with time, it leads to an amputation, or they have a high blood pressure, which leads to a stroke. When you allow things to go that bad, it becomes more costly to you. So why not invest now in food that is going to help prevent that from happening, at the same time to save you and give you a quality of life? So one, it helps prevent the diseases. Two, even when you have them, it helps you to manage them properly. Then because you are also going to meet all the nutrients you need. For example, like I said, calcium, for example, which plays a very huge role in bone health, and vitamin D. Once you are eating healthy, you are going to be sure that all these nutrients, which are micronutrients, are gotten in their right amount, which will help to give you strong bones, strong teeth, and then help you to be strong. In recent times also, there is this, it's not a new condition per se, we call it sarcopenia in medical terms, but it simply means loss of muscle mass. And typically, it starts with aging. But then, because most people tend to avoid protein as they grow older, because almost say, protein is not so good for you. Yep. We are seeing a surge in loss of muscle mass because people are not meeting their protein needs. And once you start having a loss of muscle mass, with time, your function begins to decrease. When function begins to decrease, independence too begins to decrease as well. You realize that it's just about making those smart choices, but then it helps to ward off all these diseases. So there might be very slight benefits. At the same time, it's going to save you a lot more. So invest now, you don't have to pay later. So you pay now, so you don't have to pay more later. Yeah.
All right. Priscilla, you have anything to add to that?
Yeah, so I mean, he's given very significant benefits of healthy eating. I just wanted to add a bit to that. Also things that we take for granted, like even our moods, right? Our moods are affected by what we eat or what we don't eat. Our sleep health is also affected, and sleep and mental health are all affected by what we eat or what we don't eat. And maintaining our weight. I know weight loss is something that's really important to people.
Oh yeah.
So ability to stay at a healthy weight also depends, a major part of it depends on what we eat, and not only what we eat, but how much, and the timing, and different things that come with that. So, and like the chronic diseases that he also mentioned, the strong bones and teeth and all that. So all these things, are affected by what the choices we make in terms of eating. So.
Great, wonderful. So this is a great discussion, and I'm loving it. So the next thing I wanted to talk about is, back home in Ghana, when you talk to people and they say, "Oh, nowadays there's too much diabetes or hypertension," a lot of the time, what I used to hear was that, "Oh, it's because you deal with your food and too much," right? So I wanted to see if you're eating a butcher food and too much. Is there a correlation between what we eat and where we are from? And those kind of things, how does that play a role in lifestyle, eating lifestyles?
Eric, do you want to take that first?
Okay, sure. So what I think is that, yes, so initially people used to eat what was just available to them.
Yeah.
For example, in old times, there's no way to import food to where you are. You have to hunt and get food wherever you are. Now with time, our choices became very large, with all the foods available throughout the season. At first, certain foods will be available just seasonally. But then with advancement in science and all of that, foods can be available all throughout the year. Whilst it may be true that certain westernized diets may be contributing to health problems that we may see in Ghana, our choices also matters to what we have here. Because then if you are not making the right choice with what you have available, then certainly it's going to also give you those kind of poor health that you are talking about. But then, yes, there's some influence that comes from the westernized diet. For example, some of the foods that we consider junk may come from outside food. They're not things that are naturally available here. But then they tend to come into the system, and people would want to go for it because then I said this is a new lifestyle, this is a new craze. So you all want to go for it. But there's some role there, but it still doesn't take away the fact that what we have available to can't contribute to disease, and we need to make right choices about them as well.
All right, great. Great discussion, of course. And the next question is about what is the plate concept, right? What really should be on my plate when I sit down in the evening and I'm eating, right? So I wanted both of you to look at this and explain to us what a diet or the diet that should go onto a plate when I sit down at 7 o'clock or 8 o'clock or 1 o'clock, as some people will eat very late in the night. What should be on my meal?
Okay, so we needed to make this disclaimer at the beginning that all that we are sharing here, it doesn't supersede what your healthcare provider has told you, right? This is well within the confines of this program. So there have been different recommendations on what should go into our meals, right? And it's based on the different nutrients that Eric mentioned earlier on. So Harvard has developed this plate called the Harvard Healthy Plate, and it's based on the My Plate concept that the U.S. Department of Agriculture has developed. And it's not just for, I don't want us to think that this is something for Abroche people. This is something that has been studied that's applicable to every society, right? So on the plate, and I think you're trying to share this slide, right? But it's not showing up here. So the components of the plate gives us an idea of what are some of the things that we can put on our plate, and the emphasis is that you are not required to have it on every meal that you eat, but at the end of the day, or within days and weeks and months, this is how your plate should look like. And so the plate is divided into 4 parts, and the description is that you take like a regular dinner plate, you divide it first into 2, then you divide one of the 2 halves into 2 quarters, right? And then the other half into another 2 quarters. So the first part, which we call we describe as the veggies. The recommendation is that veggies should occupy the largest part of your meals. And by veggies, we mean like the low starch veggies should have a big chunk of your meals. And by low starch veggies, I mean examples like maybe the cabbage, the contumely, the carrots, tomatoes, all the greens, ayoyo, and all the greens as much as possible. It should occupy like a little bit more than a quarter of the plate. Then you can also add the other high starchy veggies like the potatoes, the yam, the cassava, and all that. So as much as possible, if you are choosing foods, your first healthy bet is to increase the low starch veggies. Then you can also add the the high starchy veggies. Then another part of the plate is for fruits, right? So then we recommend. Okay, perfect. The picture shows up now. So this is what I meant, that the veggies, the veggies should occupy the biggest part of your plate. And it's recommended that you have, different varieties, different colors, because they provide us with vitamins and minerals and antioxidants. And all these are helpful for our immune system, right? And that's also one benefit of healthy eating, to protect and to strengthen our immune system, to help us to fight infections like even the COVID that we just talked about. So increase veggies on your diet, and fruits. Have a small amount of fruits every day. And on the next side, we have the healthy protein, right? There are different types of protein. Protein helps us, build more muscle and also provide some kind of energy and other important things in our body. So the key is to choose healthy proteins. We have healthy proteins and we have unhealthy proteins. So we have plant proteins. Examples of plant proteins, we have like beans, like groundnuts and nuts and other things. So that goes under healthy protein. And we also have animal protein, the healthy animal proteins. We have like the fish, chicken and turkey and guinea fowl, all the things without their skin. Those are the healthy options that you should go for. So as we talk about the healthy protein, we should also be aware of the unhealthy protein, which is like the processed meat, like the sausages, the bacon, all that. All those are unhealthy proteins. So the recommendation is that increase more of the healthy protein and cut back or avoid the unhealthy ones that I just described. Then we go to the whole grains. Sorry, I think you jumped the picture to the whole grain part. So that's where you have like the rices, the pastas, the corn and all that. So that for that part too, the recommendation is, increase the whole grains. And whole grains are the types that come with their grain intact, like corn that hasn't, you've gone to mill the corn and you haven't sieved, the whatever out of it. That is the healthy one. The one that hasn't been sieved, go for more of that. Go for oats. If you want to eat rice, maybe 3 times a week, make maybe 2 of those options brown rice instead of white rice, because it's full of nutrients and fiber that will, improve your health. And then the oil, we have the oil on this side. So the recommendation is, we are choosing oil, right? As much as possible, go for healthy oils, and healthy oils are also called the unsaturated, unsaturated fats and oils. So go for types like olive oil and canola oil, and cut back on the tropical ones like the palm oil, the coconut oil, because they are unhealthy. And then if you want to have a beverage with whatever meal you have, as much as possible, your first healthy option is to go for water, right? Drink more water. If you want something else, you can go for tea or coffee with little or no sugar as much as possible, and limit your juices to 1 small glass a day and avoid sugary drinks. So, and then not to forget, the last thing that is most important, it's equally important on this slide, is the last bit with the running man at the bottom, which is stay active. So we can't talk about healthy eating without mentioning the importance of physical activity. It's really important that we combine those two to be able to strengthen and protect our immune system. So the recommendation is, at least 30 minutes of moderate physical activity per week, 30 minutes, like 3 to 5 times per week. And so, it's been shown that people who are able to do that are able to cut back their risk of chronic diseases by half. And I mean, it has so many benefits. That's for another session, another day. But let's not forget to be physically active. We need to move, right? And even as much as we are focusing on eating, we can't separate that from physical activity. So a simple thing that I teach my the people I work with is, I mean, if you hear 150 minutes of moderate physical activity per week, it sounds like a lot, but you can break it down. You can break it down into like 10 minutes in the morning before you go start your day, 10 in the afternoon after your lunch, and 10 in the evening after your dinner. That gives you 30 minutes. And if you can repeat this like 3 to 5 times a week, there you go, you get your 150 minutes. So it doesn't have to be, so anyway, so this is about the healthy plate. Thank you.
All right, great. Thank you, Priscilla, for that wonderful explanation. So we'll ask Eric to add something to this plate.
Okay, sure. So when Priscilla was talking, she was highlighting the various parts of the plate. I wanted to just quickly run through some of the healthy shopping baskets so that we get to see some examples of the particular foods under some of the sections there. So for example, when we come to the vegetables, we may have options such as our own contomere. We could also have our garden eggs there. We could also have alefu, boko boko. So they are replete of local vegetables that we have available that can form part of the healthy plate. So you could have your ayoyo, your onions, your okra. All these things are very essential to be on the plate. Now, when it comes to fruit as well, also, we could also see from our local available ones. So we have our oranges, we have our mangoes, watermelon, banana, apples, pawpaw, pineapple, and then tangerine. So, I mean, all these fruits are locally available. And then the recommendation is that you should be able to fill up half of your plate with the vegetables and also with the fruits as well. Then when it comes to the protein, Priscilla has already highlighted a lot of them. So we could have in our chicken, which could be skinless. We could have in our turkey, guinea fowl. So I confirm, also very available in the north and other parts of Ghana. So then skinless guinea fowls also make the cut. Our fishes, so the fish oils or the fish with oils in them, salmons, tuna, hake, we have our shrimps. We also have herrings and all of that are also very important to be part of the diet that we have. Then when it comes to whole grains, we are looking at our general oats, brown rice, wheat, sorghum, corn, and we even have Bulgarian wheat. All these are readily available in our part of the world, and they can form part of your healthy plate. So then it's very important to have all of these things so that you're able to help to also meet your health. I'd like to show the plate with the food example so that it's very clear enough how we can put the food together, if that slide can show. Okay, so maybe whilst we wait for that, I wanted to just show you, yes. So then you probably are wondering how you can, replicate the healthy plate. So then this is our own local plantain with contomere and then fish. So then you hear that it's not as difficult as it looks. You can be able to just divide your plate and then give half of that to the starch foods or the grain part of the food of your meal, and then the other half of it goes for the vegetables, and then you have the fish there as well. Then you can form a healthy plate with all the foods that you eat. Thank you.
So great discussion about what should go on that plate, and I'm very impressed about how you presented it, right? But again, the question is this something that is sustainable, right? When people go to funerals, they go to parties, do they make conscious effort to make sure that what they're eating is something that will help them overall? Is it good to cheat? If I'm trying to, I get a little fufu here and there, even though I'm trying to diet. Is it okay to cheat?
Yeah. So I think that's why we mentioned that don't think of this as a total elimination of everything that you usually eat. because then it's not sustainable. So the important thing about this whole healthy eating is that this should be something that it's affordable, right, and it's sustainable. So if it's not something that's sustainable, then I mean it's going to be hard to follow. So
Right.
yes, you can eat whatever you want. You can choose healthier options of what you want, and you can take a healthy portion. Like when we talk about portion sizes, it's what you put on your plate, right?
Right.
So you don't. So the key is you don't totally have to deprive yourself of what you are eating, except for the no-go areas like the salty, the too much extra salt, too much sugar, and fatty items. Those we encourage you to stay away from as much as possible. But I mean, we are humans, and if you tell people to stop absolute everything,
Right.
it doesn't always work out. They'll end up going to do it and even do it more than if you hadn't told them, right? So just remember portion sizes. I can have it, but yes, I can have maybe half of what I usually have. I can have maybe I can measure what I have so that I don't go beyond the healthy recommendation. So yeah.
Thank you very much for that. And it's about planning, right? So you just don't this thing. You have to have conscious effort to be able to do all of this. So what goes into healthy meal planning?
Okay, so one thing that, like you said, a lot of thoughts and efforts would go into having the right meals. So there are some few things that we can just note when it comes to like making a plan or making sure that we're able to eat well. So first of all, you need to be able to plan your meals ahead of time. So then one of the recommendations that maybe you can plan your meals for the week. You know, you are somebody who works, and then you may not have a lot of time to decide what you want to eat when you wake up in the morning.
Right.
If you're able to sit down and then spend some quality time deciding on what you want to eat throughout the week, it saves you the hassle of then waking up and then asking yourself, "Intermediate then, or what will I eat at this time, at this point in time?" But when you sit down and you make that effort, you just know that, okay, this week or maybe tomorrow, for example, I would want to have this in the morning, that in the afternoon, this in the evening. In that way, you save yourself the stress of having to decide what you want to eat on the go. Then you're able to make the right choices, and then you can make more healthy choices, because then the time frame to make that decision is more. But then if you wake up in all the Monday morning rush and then you want to decide what you want to eat, maybe you will not make the right choice. So it's good to plan ahead of time. Now, once you have a plan in mind, then obviously ingredients must go with it. So for example, if I know I want to have oats tomorrow morning, I want to have plantain in the afternoon, I want to have it with contomere, I want to have brown rice in the evening. Obviously, those are ingredients I need to have available. So then it helps you to also create a shopping list. So then if I don't have rice available, how do I create that shopping list? So then you're able to make a list of things you'd want to get to be able to support what you have in plan or what you have in mind. Then there's a recommendation that sometimes also you don't necessarily need to go shopping when you're hungry, because then most of the time when you go in stressed or hungry, you are not likely to make the right choices. So it's very helpful to keep that in mind, that whenever you want to make those healthful choices, you probably will do them when you're less stressful or when you're not too hungry. Then there are also things where you have to keep in mind about perishable foods also. So for example, if I buy foods that will get spoiled within a few days, it's very helpful to buy as much as you would need. So that in that way, you're not forced to overeat them, because say a best saying you want to eat everything, or you are forced to eat everything because you don't want to waste food. So whenever you are dealing with perishable foods, you want to get enough of what you need. So that in that way, you're not forced to eat much, because you want to avoid wasting them or to wasting your money on all of that. So those are some few. And then for those who buy processed food or packaged foods, there'll be food labels on them. So then it's also very helpful that you're able to get to know how to read food labels. In that way, you're able to make the right choice of foods that have a lot of fats, excess sugar, because then you're able to mindfully check those out and then make those choices that I want to go in for this, I want to go in for that instead of that, because this is what will support my healthy meal plan or my healthy program.
Right.
Then basically these are some of the few things. So I'll just go through what an individualized meal plan could look like. And this one is based on 1,500 calorie diet. So then, for example, this is somebody whose calorie diet has been calculated at around 1,500, and your dietitian can help you come up with a plan like this. So it's not like it comes with magic. There are some calculations behind it. But then once we know what your calorie targets are, what your health goals are, we can come up with a meal plan that supports your goals. At the end of the day, the plan should be something you can prefer. Like Priscilla said, it should be sustainable. So we are not going to say go and import foods that are not things that maybe might not be in your reach or might not be affordable for you. But even with your own food, you can use that to come up with a plan for you. So for example, breakfast, this is somebody who we've been able to break breakfast into carbohydrate of 4 carbohydrate servings. Then it translates about 2 soup ladles of oatmeal. Then there's some teaspoons of sugar there. Then they have some slices of wheat bread. It's all emphasizing the healthy concept you want to bring out. So then this is whole grains in the meals. And the dairy product the person has there for breakfast is skim milk. So then that's a low fat type of milk. Then because we also want to make the meals balanced, we are looking for the protein source. So we added the boiled egg to it. And then there was some form of vegetables that was also added just to give it that full plate idea. Now, this person wants to also snack at mid-morning. So on their plan, there's also a fruit supported. So then that 1 serving of fruit translates to an orange. So then that also works on the person's plan. Then for lunch, this individual would want to have about 3 servings of carbohydrate. So that translates to about 1.5 fingers of the plantain, just as you saw in the picture there. Then there was a consomme stew with some amount of steamed chicken without the skin. The reason we are saying without the skin is so that you can take away some of the fats. And then we are saying steam because we don't want you to use frying method that will add more fat to them, and then it makes it unhealthy. So then the skinless chicken takes the fat away or deals with the fat. Then steaming also doesn't bring in more fat. Then in that way, you're going to make sure that the protein you're having is going to be less fatty. So on lunch, there's plantain, there's concomi, and there's also steamed chicken. Now, when we go to, let's say, mid-afternoon, this individual could still have about 2 servings of banana, which also is, workable on the person's plan. And then in the evening, they still would want to have some amount of brown rice with some amount of stew there. Okay, the slide is not showing, but then the evening meal there is presenting 3 stew noodles of brown rice. There is some tomato stew and there's some smoked salmon. Then there's also that vegetable there. So that at the end of the day, that healthy plate concept you want to bring out is still reflective in the person's meal plan. And those will just take some effort, but then once you are able to get conversant with it, you are able to replicate it and then make it part of your daily choices. It doesn't have to be, like I said, foreign-based foods. We have all these foods available, so then you can, if you need help, your dietitian or your healthcare provider can help you come out with a plan that would give you the nutrients you need, number one, and also help you to, maintain your goals for health or whatever outcomes you are looking out for.
Awesome. Priscilla, you want to add anything to this?
Yeah, I think he's, gone through it quite well. I just wanted to, a few points that one us all to keep in mind is, when it comes to food choices, let's keep these things in mind. One, choose whole foods as much as possible. Choose whole foods over packaged and processed foods. And by whole foods, I mean like the things we get in the natural states, like some of the things that he described, right? Not the package, the frozen foods and all that. We should avoid that as much as possible. Let's cook our own meals. If you do cook at home, you are more likely to choose healthy over unhealthy. So that's the part that I wanted to add to what he said.
All right, great discussion about what food is. And actually, in the words of one of my mentors, he says food is medicine, right? You can actually use food to prime your body, such that it can fight diseases. So the next, before we wrap up this part of the section, has to do with how are you gonna, encourage people to eat vegetables, right? I saw that half of that plate was vegetables, and I'm guilty with this. I go to the grocery store, with my wife, and I always grab that, spinach and all the leaves just to make my cart look good, right? And then I get home, and she's like, "Aren't you gonna eat that?" vegetable you bought, and that thing sits there, and I just throw it in the trash. I'm not the only one. They actually did a survey, and there's a lot of people that do that. Just to feel good that, hey, I also got some vegetables. How are we going to encourage people to eat vegetables, right? At home. I know we eat fufu and we use garden eggs and all of that. Is that enough, or do we need to eat more?
Okay, I can start and Eric can add it. So when we talk about changing our lifestyle and adding doing some of these things, it might seem overwhelming to people, but if we break it down into simple forms, into practical ways, it's not as highfalutin as it looks like. So let me just use an example. Like for breakfast, right? If you're someone that maybe likes omelets, right? You can add some veggies to your omelet right in the morning. And maybe for lunch, if you are making bean stew or spinach or some kind of soup and things like that, you can just add maybe like carrots. You can put carrots in your stews, whatever stew it is. You can add carrots to your stew. You can add some to your soup. You can blend. I mean, when we're making our soups, right, we use tomatoes. We blend tomatoes. You can add tomatoes. You can add some more carrots, and add it as part of your lunch or your dinner. And for people that like fruits or can make smoothies, if you can afford to make smoothies, you can get a number of fruits together, blend it, and even with the fruits, you can add simple veggies like spinach and carrots into smoothies, and that works. And also as part of snacking, right? Instead of going for the processed like potato chips and fries and all those things, you can just have like carrots, cut carrots up into small chunks, put it in a small bag, have it with you when you're maybe as part of your, if you take food to work or throughout the day, have it there, small pieces of carrots, small pieces of cabbage, cucumber, cut it and snack on that instead of the packaged foods. And also just like dinner too, you can have these same cabbage, carrots either in the raw form, or you can just steam with salt and water a little bit and add it to your food. So it all starts with a decision, right? If you do come to a point and make that decision that, okay, I'm going to try and improve things in my diet, you will be able to find simple ways to make it happen. It doesn't have to be out of the blue. You don't have to look for things that are out of your reach. Look for things within your reach that you can try to have more of. So that's what I wanted to add.
All right, thank you very much. I think we do have some questions on Facebook, and I'm going to ask my producer to project them, and then we will go through some of these questions. Okay. So we have one coming from Mohammed. Mohammed is saying that, please, is the dietitian going to add? Wait, no. I think he has different. Okay, there we go. He says, I like the dietitian very much, but how many Ghanaians can follow this dining roster? Charlie, we are even struggling to get 3 square meal. Talk about adding the fruit, and he just laughed about that. What do we have to say about this sentiment that Mohammed is sharing?
Yeah, so I think it's also a genuine concern, because then your social history too influences what choices you are able to make.
Right.
But one of the things I always come back to is the fact that whatever you do, you are still going to eat anyway. So then if you are going to eat, then make the right choices with whatever you are going to eat. Now, obviously, when you have financial difficulties, yes, you will not be able to make all the right choices that you want to make. But at the same time, to just keep in mind that whatever you can purchase, there's a way you can still work around that, just to be able to meet the nutrient that you need. Because then some hide behind the fact that I don't have money, and then the trade-offs they may buy in its place may not be the healthful ones. Okay, like they will say, oh, we need to better fruits, but then they may buy a soft drink that is the same price as the fruit.
Yep.
So the trade-off is not a healthy one. So then, yes, those financial challenges will make it difficult to make the right choices sometimes. But at the same time, to just keep in mind that if you want to make the choice, or you have the means to make the choice, then make it right. That's all I have to say.
All right, great. So, Mr. Producer, can you put us the next question on from Facebook? All right. So I think we have Steve saying that can you eat breakfast of oatmeal in the morning, wache in the afternoon, and fufu with palm nut soup by 8 p.m. as a healthy diet? It looks like he's reading my mind. Oh.
Lisa, do you want to go first?
Okay. Yeah, I can go. Yeah, this is a very great question. So I'll start off with this anecdote that says, eat breakfast like a king, eat lunch like a prince, and then eat dinner like a pauper, right? So in that description, it's kind of giving you an idea about how you can tailor down the density of the food, like with the time of the day. So one thing to note that you can make healthy choices, right? But there are other things that you need to consider when it comes to even the healthy choices, like as I mentioned before, the portion sizes, right? The calories in the food, and also the timing. That the timing that you eat is important, right? If you're going to eat fufu and palm nut soup by 8 p.m. and you're going to get ready to sleep, then all the energy that food is going to produce, you are going to sleep, you are not going to use it. So what happens? All that extra calorie from that food is going to be stored as fat, right? So then it will be not surprising if you are gaining weight and you're not sure what you're doing. So it matters, the timing of the day and what you eat matters, right? So breakfast of oatmeal in the morning, it's an excellent idea. Oatmeal has whole grains. Oatmeal has fiber. Oatmeal has a lot of vitamins and vitamins and minerals. So that is a great idea. Wache in the afternoon is also a great idea. Wache has beans with all the things we mentioned, the proteins, the whole grain, and the fiber. So excellent idea. But the timing does matter, right? If you I mean, as much as possible, as it's getting to the end of the day where you are less likely to use energy, right? It's better to go for lighter foods, right? Or even if you want to eat fufu, then don't take it to 8 p.m. Take it to like 5 or 6. That way you still have time to work it out, go for a walk or do something to burn out all that energy, that energy. So anyway, Eric can add to that.
Yeah, so I mean, you've said it all. So then, like we said at the very beginning on what healthy eating is. So it's not necessarily restricting yourself or depriving yourself of foods you want to enjoy. So then, yes, every meal may form part of a healthy diet. Then we just keeping the principles in mind. So then, this has mentioned the issue of timing. So yes, so if you continuously eat food quite late and let the energy dense, at the end of the day, it's going to rather help you to rather gain weight, and which will also bring in some other health consequences. So then you could still have your oatmeal in the morning, there's no problem. You could have your watching in the afternoon, there's no problem. You could still have your fufu in the evening, there's no problem. So you keep in mind the timing, the portion, the quality of what is going into the meal, all of them counts. And at the end of the day, it's going to give you what you need to be able to maintain your health.
Yeah, so Priscilla mentioned something, and I wanted to ask this question. So, what do you guys think about the wache and the wole? Does the wole play any role? Because having wache without wole is like having Africa without Madagascar, right? But there's so many arguments about whether it plays any nutritional role. So let's answer that in 30 seconds.
Okay, so from the best of my knowledge, I really don't know what the nutritional content of wele is, but from what I have known from time immemorial is that it doesn't really have any nutritional value in quotes. While some have argued that out, that there could be some other nutrient that is still presenting. At the end of the day, the way it's also prepared to has raised some concerns too for some people because of the way they say they burn ties and all of that. So we need to just keep in mind that yes, it may not give you all that you need, but if it's going to replace something, probably the reason why you want to have the relay is because you don't want to have fish or you don't want to have egg. You probably want to consider the quality of what you are getting. So then if you're having wache and it's going to come with wele, what could have been the alternative to wele? Okay. And that be much better compared to the wele. So then, yes, it's not to say that, necessarily the wele is bad or anything like that. So because I can't really give much info because I don't know its nutritional content, we would still say that it's so helpful that you're able to make the right choices with what I mean, the alternative that could be there, like the egg or the fish, which could play a better role of giving you proteins. And the beans in the plant, I mean, the wache too also gives some proteins too. So that you have to also take in mind. So that's some plant protein there. But then, yeah, again, you need to consider the quality of what you are getting. Is
Right.
efficient enough to give you what you need? And that should be kept in mind.
Right. Thank you very much for those great information. So there's a question from Christian Opoku, who is pretty much concerned about GMOs. So he indicates that there's a great inside dynamic panel, but he's still concerned about GMO and the reality of pesticides, even as assumed healthy green plates can offset the right meal. How do you deal with that threat against our food pyramid? That's a loaded question. So he's pretty much looking at what GMOs and how they play a role in our diet.
Yeah, let me attend to this question. So like I mentioned just a short while ago that the encouragement is that as much as possible, go in for whole foods, right? If you consider that important point about looking for foods that come in their natural state, then you are going to be safe from a lot of these GMO stuff as well. And I don't know if Ghana has a lot of the GMO stuff at this time, but I know we have to deal with that a lot here. So that brings the important point of reading labels, right? If you are going to be buying packaged food and processed food, it's important to read labels. And the GMOs, I think they are required to note that on the labels that this is a GMO product. So I mean, I don't have enough scientific information to say GMOs are not okay or okay. I don't have that now. But I mean, personally, as an individual, I try to avoid GMO foods if I can. I mean, I will try and look for like whole natural products that I can guarantee, because I don't know too much about the science and the complications of that. So
all right,
that's all I can say for now.
Okay, great discussion again. So as we're about to wrap up the show, I wanted to touch a little bit about snacking, right? Some of us wake up late in the night and we munches, right? We try and eat anything we find in the kitchen. So what do you say about that? Is there a right way to snack, or you just can do it any time of the day?
Okay. So then I think that sometimes snacking gets bad mouth that, or I mean, if you snack, then it means that you're going to put on weight. If you snack, it means that you can't follow a healthy diet. But then the important thing for us to note here is that snacking is not necessarily the problem. Okay, so it's not necessarily that if I snack, that is going to be the problem that I'm going to face. But then the choices you make, or what snack choices you pick, and sometimes what makes you or what informs your decision to go and snack. So then there are some things that we often may recommend when we come to like helping you to snack and then not still derail from your healthy eating program or your healthy eating plan. So for example, it's very helpful not to skip meals, because then let's say, for example, you chose not to eat in the morning and you were late for work. Now you didn't have any plan in mind of what you want to eat. You are more likely to end up going in for whatever is available. So then most of the time, the choice that may be available may not be necessarily healthy. So then it's very important that if you want to follow a healthy meal plan and snack at the same time, you may want to avoid skipping meals. So that in that way, you don't necessarily get hungry to be pushing yourself to think about what to also take as a snack. Then your food environment is very important. So there's a concept called a seafood diet. So then it says that whatever you see, you would want to eat it. So then your food environment plays a very huge role to what will be your choice for a snack. So then if you decide to laden your fridge with a lot of, let's say, soft beverages with a lot of sugar, added sugars, then that is going to be the only snack options you have. But then when you decide that you want to be on a healthy, or want to go the healthy way, you can choose those healthy snacks you'd want to add onto your meal plan, and then create that environment that will be able to help you to make those right choices. So then what you see is what you tend to eat. So then when fruits are available, you would want to go in for that. And then the other thing that we should also keep in mind is that snacks can be carried along to work. So it doesn't necessarily have to be that you always have to get snacks, probably from where you're going to work. You can also plan it from home. Let's say cut fruits. You know you're going to go to work, and at 10, typically you would want to eat something. Maybe you eat around 6, 8 a.m. or 6, 7 a.m. before you leave for work. And by 10, you are feeling hungry. What would you want to eat? If you have a plan in mind, which we already discussed earlier, you could decide on carrying on some snacks. So you could cut on your fruit, you could cut on your vegetables. If you even want to take in some roasted plantain, you can have that in mind, plan for it, so that when you get to work, you are able to know what you want to also take. Then there's something about mindless eating. You know that thing that happens to you when you're watching television or you're doing something else, and then you realize that your plate is finished and you don't know how the food even got finished, because whilst you're eating, your mind was not really on the food you're eating. So then mindless eating can make you eat more than necessary. So then you need to be a little bit mindful about what you are eating when you are choosing your snack, so that you can also think about what you need to do. The other thing is that there are times where you'd want to really be sure that you're actually hungry. There are times where you may get hunger signals, and you may think that, oh, I'm really hungry, I want to get something to eat. It may not necessarily be hunger. So sometimes what you may want to do is that maybe you may want to take in some water, or maybe just ask yourself whether in this moment is this something, are you stressful, and will food be the answer to that question? If food is not the answer, then maybe you want to probably find a way of distressing, whether it's good music, whether it's to talk to a friend, social support network. It might not be food all the time. So then you need to be able to key in or zero in on what is actually making you feel hungry in that sense. So you can actually make the right snacking choices when you have a plan in mind, when you're able to tell yourself that this is what you want to be able to snack on. And then you're able to be mindful about the portions you want to have. And one thing too is that, for example, if I go and have a gallon of let's say plain yogurt, which I want to snack on, it's helpful that I rather would pour that in a cup that I would know the portion I'm having, rather than to drink directly from the container. Because in that way, I may end up drinking the whole thing. But if I'm mindful about, okay, I want to be able to just drink a cup of that plain yogurt rather than to drink the whole gallon or that small gallon of plain yogurt, then it helps me to keep myself in check, have my snack, have it the right way, and also I'm making that right choice as well.
All right, great information. And again, we are running out of time, and we need to have a part two of this discussion, because I have so many questions, that I wanted to ask. So as we're wrapping up, there's a question about coming from Roddy. It says, are meal plans always on individual basis, or can we have family meal plans as well? That's an interesting question. Can any of you help me with that?
I think I'll let the dietitian start off with that.
Okay. So meal plans can be individualized. We can also make meal plans for families. But like I already said earlier, because of the varying nutrient needs between different ages and then different sexes, sometimes if you decide to make a whole family plan on specific things, it might not necessarily meet everyone's needs. So yes, you could come up with a plan of the food choices that could run for the whole family. And then when it comes to, let's say, what amount each individual should have, those could be made on an individual basis, so that at the end of the day, everyone else is able to meet their nutrient needs. But nothing stops the family from having a plan together. But if you want to be able to make sure that you are having the right amount for each person in the family, there might be some individual things placed in just to make sure that everybody is having the right amount they need to have.
Yeah.
Awesome. Great. Priscilla, you have anything to add?
Yeah. So I think this concept that we just talked about there, healthy eating plates, it's something that can translate to every gender, every age, right? It doesn't discriminate. But maybe if you're making family meals, right, depending on maybe someone is living with a chronic condition and all that, then you have to make up for the people that have special diets. But the encouragement is that if there's no specialized diet needed for anyone in the family, then we can all aim to tailor this this kind of Eden for everyone in the family, because charity begins at home. A lot of the chronic conditions that people struggle with later in life, it starts from childhood. Getting high cholesterol, atherosclerosis, like the high cholesterol issues and all that. It all starts from home. It all starts from a young age, right? So we shouldn't think that maybe when I'm 20 or 21, that's when I start building up, cholesterol in my arteries. Right from, baby, childhood, toddler, what they eat matters, right? And there are some people that are predisposed to like high blood pressure or high cholesterol. I mean, genetic disposition to that. So with them, like they can have, very high unhealthy cholesterol at a very early age. I knew of a child here who he was 8 years old, and his cholesterol levels was over 200, right? No one would ever have thought that a child would, have such high cholesterol levels. So, I mean, in summary, what I'm trying to say is that charity begins at home. Let's focus on healthy eating for everyone in the family, right from when we are born till old age. So.
Right. Thank you very much to both of you. Wonderful discussion today about what we put inside our body. And again, we didn't talk too much about what we drink, right? So that's going to be part 2 of this discussion, right?
Okay.
We are running out of time. So we're going to bring you guys back. And again, this show is going to rebroadcast tomorrow at 5 p.m. We're going to have a rebroadcast of this on our channel. So we'll definitely bring you guys back. And again, I have plenty of questions that I couldn't answer because I couldn't get answers to because of time. So as we leave or wrap up the show, I want each one of you to give your last words to our listeners, and then we'll wrap up the show from there. So let's begin with ladies. Ladies first.
Yeah, I think we have the final slide that summarizes everything we want to say. So if you can show the last slide, and then we'll just focus on that. So this is a quote by Michael Pollan, who's written this book, and he said 3 sentences: eat food, not too much, and mostly plants. So with that, the emphasis is eat food. That comes to choose whole foods above processed or GMO or whatever. Choose whole natural foods, and not too much. Not too much means calories, right? So do not take too much food or put too much food on your plate. Be conscious of portion sizes, be conscious of calories, and mostly plants. And that's what we've tried to establish today, that you can't go wrong with vegetables. You can't go wrong with low-starch vegetables. Make that the biggest part of your diet as much as possible. So, yeah, that's what I want to end. I don't know if Eric has something to add to that too.
Okay, so then, I mean, you said it all, but at the end of the day, I also want to just say that we should bite into a healthy lifestyle today. We sometimes have the mind that we can put off things for tomorrow. I mean, the risk is not there. So then I would want to wait till tomorrow before I start doing something. The take-home message should be bite into a healthy lifestyle today. I mean, eat healthy, exercise, sleep well, manage your stress. All these things are very important. If you're taking alcohol in moderate forms, if you don't take it at all, don't even start. Don't smoke. All these things are very important. At the end of the day, it's about what you do today that is going to influence what tomorrow is going to bring. And then with the current dietary guidelines available, there's a statement they make that make every bite count. And I think that line of message is very real, that you make every bite count. So everything you eat, you should make it count. So I just want to end with that phrase, to make every bite count.
All right, thank you guys, and I can't thank you guys enough. We're gonna bring you guys back for part 2 of this discussion about food and what we can take into our bodies that makes us, healthy. So without much ado, I'd like to, on behalf of HIA, thank you, Eric, and thank you, Priscilla, for coming on the show. So, producer, it's been great. If you want to join the conversation, ask some few questions about our great panelists today, you're good to go.
Thank you.
Yeah, thank you very much, Eric and Priscilla. It's been wonderful having you here. And as Edward has said, we need you guys back I just kept on. I just kept on smiling throughout the whole show. I have so many questions that are packed and piled for you guys. So get ready for them next time. So
All right,
yeah,
sure.
thank you for coming on.
Thank you.
Okay.
Mhm.
Thank you for having us. Mhm.
Yeah. Thank you.
All right, thank you very much for staying with us for this week's edition of the Health Info Africa show. It's been wonderful. We learned a lot about COVID-19, and then we also learned about healthy eating. And it's something like Edward said, and like I've said, we're going to bring our panelists back because it's a very useful conversation to have. And then we need to be able to incorporate healthy eating as part of our lifestyle and not just make it a 1 week or a 1 day thing or a New Year's resolution thing, and then we just leave it at at the
Right.
door in January. Yeah.
Yep.
So.
That's true. Yeah. So yes, we're gonna rebroadcast this. I think it's gonna be late in Ghana, but it will be 5 p.m. Eastern time, in the East Coast, and also that will be 4 o'clock in the Central time. So again, until we meet next week, stay healthy and wear your mask.
Yep. All right. Bye.